Hello, everyone. Hello, participants. Thank you very much for bringing me this opportunity to participate today as a speaker and as a PhD representative. I would like to share with you how the HIV field works in Ukraine before and during the war. Um, as far as all you know, on 24th of February, the Russia launched a large-scale invasion of Ukraine along the entire length of the common border and from the territory of Belarus. And data on 1st May from the United Nations organization already recorded 6,469 of civilian deaths and injuries in Ukraine during the full-scale invasion. More than 12 million Ukrainian refugees had to leave their homes because of avoiding the danger. The amount of destroyed medical facilities are getting bigger and bigger every day of the escalation. Unfortunately, some of medical workers already were killed and injured. And humanitarian catastrophe on the occupied territories is daily going worse because of damaging food warehouse, oil depots, and water treatment plants. A bit of statistical data. Since the beginning of HIV epidemic in Ukraine in 1996, it mainly affected people who injected drugs. But as you see, in the last decade, it completely changed, and sexual transmission had been the main reported route of HIV transmission. It is estimated that a comparable number of men and women are infected. To compare with the first quarter of 2021, in the first quarter of 2022, we already see the decreasing of new HIV cases up to 30% and prescription of antiretroviral therapy up to 33%. The results of forecast show that after 2020, the number of HIV new cases will continue to decrease. Again, the background of the decrease is that estimated number of AIDS deaths since 2010. However, based on the analysis and the indicators of the epidemic, it can be concluded that the country is 5 years behind of the fast-track strategy, especially in terms of RT coverage and the reduction of new HIV cases. That's it for at least for 5 next year. The HIV epidemic in Ukraine can be considered as controlled. The negative impact of COVID-19 pandemic on access on HIV services in 2020 has led to decreased compared to 2019. The volume of HIV testing, the number of detected and registered new cases of HIV infection. Sadly, it should be recognized that full-scale invasion will lead to the negative consequences as well. It is important to notice that in 2021, Ukraine already led her first 95 in 95-95-95 strategy up to 2013. The people who live in with HIV who receive RT and reach the viral suppression. Before the war, we were having developed ways to achieve these goals, but unfortunately, because of full scale of invasion, we cannot be sure that we will gain all of these goals. Overall, in the first quarter of 2022, we have a decline of key indicators, both of the detection of new cases of the appointment or IRT, but despite the war, the work is still ongoing. And as far as we had in the first quarter of 2021, the number of new HIV cases was 5,012. In the first quarter of 2022, this amount is 2,700. 88, which is 33% less than it was 1 year ago. For the beginning of 2022, we already achieved a great goals in the decentralization of antiretroviral therapy, and for the start of the year, 403 hospitals in Ukraine issue RT. Unfortunately, because of full-scale invasion, now just 361 hospital works with RT. We made a huge work with the optimization, and the last 5 years amount of people living with HIV on dolutegravir regimen increased in 4 times. We made a good work with a rapid start on HIV treatment, and now around 70% of patients start RT the same day. More than twice we covered the amount of clients of PrEP to compare with the previous year. We'll also keep on working on the elimination of mother-child HIV transmission. And since 2017, we have a medical informational system for doctors who work with HIV patients and for public health center representatives. And because of this program, we can monitor and provide medical care. Unfortunately, during the wartime, a large number of challenges has to be faced day after day, such as migration, which is ongoing. And of course, this is not the same amount of the migration as it was first few weeks of war, but still the process is ongoing, such as inside the country as abroad. We have a lot of challenges in the logistic of antiretroviral therapy, both within the country and abroad. And due to active hostilities and occupation of territories, it is difficult to replenish medicine in timely manner. This is a lot of problems with destruction, damaging of medical institutions, with evacuation of medical workers. Unfortunately, we have now a huge problem with the gender-based violence on a temporary occupied territory, as long as the territory is staying occupied by Russian soldiers, the amount of gender-based violence is keep growing, and sometimes just because of lack of connection with the doctors, we are not sure about the possibility of getting PEP. Access to mental health programs, physiological, legal support abroad, combating gender-based violence, including for key population. So a bit of refugees a bit of people living with HIV refugees. WHO already calculated the estimated number of these refugees, and this amount is going to be around 30,000. And as far as we understand that the emergency is significantly affecting neighboring countries that are first entry points for many displaced people from Ukraine. And as a closer country, the Poland, and we already expect that the biggest amount of people living with HIV refugees will go directly to the Poland. And if we will talk about the informing the people who need the RT, how to get the RT if they left their homes and they do not understand where to go, we made with the help of our partners, we made several informational point where you can find the information. First of all, on the official public health center site, we have an informational panel, and if you will go on this QR code, you can put there the information about the region or city where you are staying now, and you will find the information about the closed hospital who can provide the access of antiretroviral therapy. Also, we have a national HIV/AIDS hotline which works 24/7, and the people who is working on that hotline can provide the same information. We are It's a pleasure to thank the IC, because with the initiative from the IC and Public Health Center, Art to Ukrainians Abroad, gives a lot of information for people who are staying in another country, where should go to get the antiretroviral therapy and how the doctor there can help. And also, the last but not least, the service Help Now is providing already. It's a platform where the people also can put a request about the RT, tuberculosis, hepatitis drugs around the world, and this service works on a different network, so it's pretty useful and pretty helpful for people who do not understand what to do and where to get the antiretroviral therapy. There is still a lot of work is ongoing and daily challenging, and we are trying to cover some problems which might happen every single time. So we are trying to provide for our patients the antiretroviral therapy for 3-6 months. We have a stock of RT in a central warehouse to respond quickly in case if some region will need some access to antiretroviral therapy. And because of volunteers, thanks to volunteers and thanks for the organization 100% of life, we can deliver it as fast as it possible in a wartime. We already made the fast algorithm of data exchange between the doctors about the patients as inside of Ukraine and abroad. And of course, assurance of RT not at the place of registration. We have a patient-based approach that the patient might get the antiretroviral therapy where he is already physically staying. And I would like to thank you, and I would like to finish with this slide. Of course, I would like to tell that plenty of thanks for all of our partners who permanently helping us in providing and improving antiretroviral system. This is the PEPFAR, WHO, CDC, Global Fund, IC, non-governmental organization, Alliance of Public Health Organization, 100% of life. All of the volunteers who are helping every single day to improve and to give the access for the RT for all the people who need this. And thank you very much. In case you have any questions, please, I'm here to answer them. Thank you.